And you should all see a pop-up that says, okay, you're okay with it being recorded. This is so for folks who can't join today that they're able to access the information. And then lastly, for anyone who just joined, I do want to make sure everyone here selects the appropriate language channel. So we have two today, English and Spanish. You can do that by clicking the circle on the bottom of your Zoom screen that says interpretation. You'll see English, so select English if you want English, and then Spanish if you want Spanish. All right, we'll get this thing started. So I'm going to share my screen now. All right, can everyone see the blue, light teal blue screen? If you can't, let us know in the chat box. But we'll go ahead and get started. So again, thank you everyone for coming today to our second advocacy workshop. My name is Uju, and I am the co-director of Oregon Health Equity Alliance. And today's topic is post-session process and lessons learned from the past with Latricia Tillman. But you know, it's always great to start with a little Zoom tutorial and overview so we make sure that we're all on the same page. So one, as I mentioned before, you'll want to make sure you select the language channel you'd like to hear today. Again, we have two options, English and Spanish. You can select that by clicking the little globe with lines at the bottom of the screen. And then, well, you can't see each other, but if you want to see all the speakers, you'll select gallery view so you can see the speakers and interpreters. And that's the button with the 9 squares. And then again, you can submit questions or let us know how things are going by selecting the Q&A button or the chat button. You can see other participants by clicking the participants button. And if you have a question towards the end, you can raise your hand. All right, now that we've gone over the Zoom functions, we'll officially start with a land and labor acknowledgement. So every community owes its existence and strength to generations of ancestors who contributed to our hopes, dreams, and collective possibilities. Together, their history allows us to leave our own legacy of hope and justice. Our collective history is that of cultural resilience, re-indigenization, adaptability, colonization, settlement, systemic violence, racism, and forced displacement. Acknowledging this truth helps build mutual respect and connection across diverse communities and lived experiences. So, land acknowledgement, we want to start by acknowledging the land on which Ojai is situated and which we occupy tonight. What we know as the Portland metro area rests on traditional village sites of the Multnomah, Wasco, Cowlitz, Clackamas, bands of Chinook, Tualatin, Kalapuya, Malala, and many other tribes who made their homes along the Columbia River, creating communities and summer encampments to harvest and use the plentiful natural resources of the area. We are on this land because of the forced removal of its traditional people by white colonists and settlers. We recognize that the rights of Native and Indigenous people and nations have been and continue to be denied and violated. We want to thank the original caretakers of this land and their descendants who are still here. In addition to our thanks, we encourage folks to take action in supporting Native and Indigenous communities by learning more about the Indigenous people of the land they occupy, honoring treaty right obligations, creating deeper relationships, and land back to Native communities, amongst other actions. And then we'll also do a labor acknowledgement. So we must acknowledge that much of what we know of this country today, including its culture, economic growth, and development throughout history and across time, has been made possible by the forced labor of enslaved Africans and their descendants who suffered the horror of the transatlantic trafficking of their people, chattel slavery, Jim Crow, and repressive laws, including the Black exclusion laws in Oregon that continue to impact Black folks today. We are indebted to their labor and their sacrifice. Moreover, we must acknowledge and address the tremors and legacy of that violence throughout the generations and the resulting impact that can still be felt and witnessed today in Portland, Oregon, and beyond. So we're going to take a moment to pause. All right. So who is OHE? Maybe you're not familiar. Well, OHE is a people of color-led collaborative. Actually, first, one. OHE stands for Oregon Health Equity Alliance. Lots of acronyms. OHE is a people of color-led collaborative organized to center and uplift the wisdom of our communities of color through racial justice-informed health equity policies and practices as part of the movement to dismantle white supremacy and shift the imbalance of power. We envision a world where people of color are able to lead fulfilling and healthy lives, however they choose. And we do this through three bodies of work. One is advocacy, so advocacy and policy, which we'll learn more about today. Convener, by convening spaces like these ones, like this one, where we come to learn and share resources with each other. And then knowledge center, which includes our trainings and tools dedicated to racial justice, health equity practices and policies. And what are we here to do today? Well, participants will learn more about what happens after a bill is passed or not passed, information about rulemaking committees, understanding funding and implementation after a bill is passed, and lessons learned from past racial justice health equity policy efforts. Remember, use the chat box and question function to let us know your needs and our questions. If you are speaking, please say your name before speaking so you know who you are. Again, this session will be recorded. It is being recorded. And reminder to take care of yourself. So if you need to take a break from the screen, turn off your cameras aren't on. Take care of yourself as you need to as you're in this session is the long and short of it. All right, we're here. We're doing it. Now comes Latricia Tillman. So I'm going to pass it to Latricia and let her speak while I set up her PowerPoint.
Okay, thank you so much, Uju, and thanks everyone for inviting me to be here. Muy buenas tardes y bienvenidos a todos. I'm very happy to come and speak with you about the information that I have learned over the past 10, 15 years or so of doing equity work in Oregon and across the country. Before I jump in, I want to let you know that I did speak with your earlier speaker, Lakitha Elliott, and she shared her presentation, so I'm modeling my presentation after hers. So I'll just start with a little bit of information about me. Again, my name is Latricia Tillman. I am a fourth generation Oregonian. I am multiracial. My mom was white and Sistan Wapton, which is a band of the Sioux tribe. My grandmother was from North Dakota, and she came out here as a child. My father was from New Orleans, and so through him I have an African-American culture and racial identity and a special affinity for what I consider to be the New Orleans ethnicity. I think there's just something very unique about being from New Orleans, given its history as a more Caribbean-facing Southern United States city. I was raised by a single mom, and she was a union member. My whole education from grade school through graduate school, I did on scholarship. In my undergraduate degree was in political science. I just have a love of all things politics. And even though I really didn't understand policy, and I'll share a little bit as we go forward how what I'm learning and still learning about policy. But my master's degree was in public health. So I have a very deep love and appreciation of the work that the Oregon Health Equity Alliance is doing and how fundamental that is to everything else that we care about in our communities. I raised my son as a single parent, and his dad was involved, but still single parenting is a thing. He's in the picture in the bottom. That's me, my son, and his girlfriend. I personally have been impacted by health inequities. My father passed away in 2005. He was 68, so early death due to heart disease and diabetes. And I think when we talk about health inequity, we often talk about it like it's a data point or just a final consequence when somebody is either sick with chronic disease or they die because of chronic disease. But we don't often talk about what gets lost in terms of family legacy when we lose family members early. And so things like my son and my nephews and nieces' ability to have a grandfather, like that's gone. His ability to pass on family story, that's gone. All of his siblings also died early for different reasons, but all of them were impacted by health inequities. And so that whole generational transfer of knowledge and wisdom and wealth is all gone. And so I feel very deeply impacted by health inequities. And since he and his siblings grew up in New Orleans, which was very much a part of the institution of slavery. You know, you may have heard of King Cotton in New Orleans. Louisiana was the home of Queen Sugar, both of the two major economic drivers of the institution of slavery. And so all of that, I feel, impacted his life chances. And for me, it connects me very much to the civil rights movement. And I often quote Dr. King, who, now I'm not going to be able to quote him exactly, but has a quote that says, of all the inequities in healthcare are the most inhumane. And I'll find the actual quote and put it in the chat before we're done. But I feel like the civil rights movement was in part about ending injustices in healthcare. I am now very proud to be a homeowner and a landlord. And so, you know, part, I think, of my personal journey and thinking around health inequities has come back around to, I think, in the same way that Dr. King, his thinking evolved, comes back around to economic justice and economic well-being, particularly for Black, Indigenous, and other communities of color. And I have been doing equity work for over 20 years now, going on 30 years. But equity work in government for 22 years. I actually started my equity journey in Tucson, Arizona, at El Rio Santa Cruz Neighborhood Health Center, which was a part of the community health center movement. And that particular health center was started by the Latino and Mexican American community and the indigenous tribes in Tucson and Southern Arizona. So that organizing for health really informs my whole ethos, my whole career around equity work. So that's a lot about me. Next slide, please. I did want to share with you here, as I did with Uju when we first met, that being invited to come and speak to OHE was a huge honor, because when I started my work at the Oregon Health Authority in 2009, one of the major accomplishments of that work at the Oregon Health Authority, the Office of Equity and Inclusion, was establishing regional health equity coalitions. So being a partner in the establishment of OHE way back when, maybe 2011 or so, was something that was really important to me, to bring voice and power to community across Oregon, communities who had not historically been involved in health policy, and to bring funding to those coalitions and support their authority, their ability to organize, their ability to make change, was all very important. But we also did a lot of work around civil rights, language access, the training for equity leaders across all different professions and organizations, bringing folks together in a training cohort model. The work that we did around establishing recognition for traditional health workers, including doulas, community health workers, promotoras, peer health, what is it called? Peer wellness specialists and peer support specialists. And then building equity in healthcare, Oregon's healthcare reform, and then thinking about equity in data. Those were all initiatives that I led when I worked at the Oregon Health Authority Office of Equity and Inclusion. And those are the pillars of equity work that I've brought forward into all of my other equity leadership roles since then. Next slide. I think before I go into the policy roadmap, I just want to emphasize to this group and to anybody else who watches this afterwards, is that the members of OHE now, you benefit from and you stand on the shoulders of what I would say are generations of OHE members who have actively contributed to the work of OHE and have leveraged the expertise that they developed as members of OHE into amazing career pathways. And so my encouragement to you is that you look at the OHE family tree, is what I'll call it, and look at where people have gone and the difference that they have made in the state of Oregon and across the country since they were members of the Oregon Health Equity Alliance. It is remarkable, and it's so encouraging to me, because all of us who have been involved in some way in OHE are regular people who care about community and care about health. And the history of OHE has shown for over a decade that caring, committed, diverse community members can make a huge difference in the landscape of health and healthcare and public health in our state and in our communities. So I just want to start with that encouragement for you. And Uju knows I could go on and on and on about all the individual people who've contributed to OHE and where they are now. So I'm happy to be a resource for you going forward. Okay, so changing gears, let's talk about policy. So here's just a funny story. When I applied to do my master's program, though I got into all the schools I applied to. I applied to like Harvard and Yale just to see, can I get in? Because college, I didn't think I would get into any college. But the one school I did not get into was the University of California at Berkeley. And they told me that they didn't think I had enough of a policy background. And they were right. I didn't know what policy was. And then in my career, I have found out what policy is and have really come to appreciate the power of policy. So in very simple terms, we're going to just walk through this policy roadmap. And some of this is probably repetitive. But the policy concept is just an idea. It's somebody's thought about what could make a community better. And it would mean something that government would do for society, right? Public policy, something government would do for society. In our homes, we may have policies as well, and that guides what our family would do. Or in our business, we may have policy and that guides what our business would do. But public policy is those ideas that guide what government will do for society. In your prior training, you talked about a legislative bill and how a bill becomes a law. So legislative bill is a policy that survives the vetting process within the House of Representatives and the Senate and the governor. And the way our democracy is formed, most bills don't survive. So survival is for the few and for the determined. When a bill becomes a law, it becomes in Oregon, it becomes an ORS. And that stands for Oregon Revised Statutes. And those are, that's the language that the legislation takes when it gets turned into a law. And those are standards, principles, or procedures that must be followed. In a bill, sometimes you see words like may or shall, like an agency may do this or an agency shall do that. May, the term may is about being permitted. An agency is permitted to do this, they may or may not do it. If a law says shall, then the agency must do that. But in any case, those standards, principles, and procedures must be followed. So an agency may choose to do something or choose not to do something if they have the option. That's still following the law. If they must do it, they must do it. And then what we're going to talk about today is the rulemaking process. And the rules are called OARs, and that's Oregon Administrative Rules. Okay, so we can go to the next slide. So the drawing on the left side of the slide, to me, is an illustration of what happens between a policy concept that becomes a legislative bill, that becomes a revised statute, and then becomes an administrative rule. And at every step in the process, more and more details get added. So Oregon administrative rules are those agency directives, standards, regulations. They tell an agency how to implement or interpret the law and how to put the law into practice. And it establishes the requirements of the agency. And so all of that language basically means that in the administrative rulemaking process, the agency, with advisement from community, is determining how to put the law into action. Let's go to the next slide. Okay, so in rulemaking, that's where oftentimes it could be the agency alone is doing a rulemaking process. They're filling in those details of how a law gets put into action, but they often have rulemaking advisory committees, and those are committees where the community or providers or other policy folks can come into that process and help advise on the creation of those rules and the details related to those rules. I wanted to just put into the slide a few examples of rules advisory committees that are happening now. And so you can go to the Oregon Health Authority website and search for rules advisory committees. If you're interested in like health care delivery or behavioral health care delivery, you would look for rule advisory committees in the health systems division. That's the division that covers all of the Medicaid services and all of the behavioral health services. So both for Medicaid, but also for people who can't, who aren't covered by Medicaid, but still need behavioral health services. So you can see there's a behavioral health rulemaking notice, and then there's an Oregon Health Plan or Medicaid rulemaking notice. And then in the website, they will identify upcoming committee meetings. So basically the rulemaking process is a bunch of people just like me and just like you who sit around and connect what was said in the actual legislation that was passed, or the ORS, the Oregon Revised Statute. And then they figure out the details of what needs to be built out into the rules so that agencies know how to put the law into action. Usually this is done with a lot of help from the Department of Justice. So that's the Oregon attorneys who support the Oregon agencies. They kind of create a template that rulemaking staff can follow. So in general, staff aren't creating rules from scratch. There's a template. And so if you're participating in a rules advisory committee, you might be looking for language that's missing, and talking about language that needs a definition, or concepts that may have been in the legislation that need to be brought to life in the rules. All right, let's go to the next slide. So what opportunities exist to participate in rulemaking? What I showed you on the prior slide was some rulemaking opportunities on the healthcare side of the Oregon Health Authority. And then here are some proposed rulemaking opportunities that connect to public health. And they basically provide some other opportunities to engage. So if you aren't able to sit on a rulemaking committee, you can still participate in rulemaking by submitting written comment, or if there's a public testimony, you can come and provide your oral testimony in the rulemaking process. And that testimony has to be considered, and there typically is a response to the testimony about what was incorporated into the rules and what was not, and if not, why not. How can you get onto a rulemaking committee? Oftentimes there might be something that is announced on a web page, but if you were involved in advocating for the passage of the law, some other ways of getting onto the rulemaking committee would be to stay connected to the legislative staff who supported you in getting the law passed. So your legislative advocates or champions or allies, they can help you get connected to the rulemaking committee. If you have relationships with agency staff, they can also help you get connected. And so in that case, I would say specifically connecting with the staff at the Office of Equity and Inclusion, they can help you get connected to the rulemaking committees as well. And then sometimes lobbyists or other community partners are aware of rulemaking committees, when they're happening, how the selection process is going to happen. And you can do a little bit of organizing about what names you want to put forward to be on those rulemaking committees. I will just share a little story here because, like I said, we were involved with OHE when we started doing work around traditional health workers. That was a community priority, but we also worked with just a community leader, Shafia Monroe, who is a Black midwife in Oregon, who has been practicing and advocating for midwifery and doula services for decades now. She passed a bill, had just pretty much worked with a legislator. At the time it was Representative Tina Kotek, who then became Speaker of the House, Tina Kotek, who is now candidate for governor, Tina Kotek. And so she passed a bill that focused on doulas. And then we also worked with Speaker Kotek, Representative Kotek at the time, to build language about traditional health workers into Oregon's health care reform. And so in the rulemaking process, there was a specific set of rules that we focused on specific to traditional health workers. And as part of that, we had to connect the certification of traditional health workers to some rules specific to background checks so that those traditional health workers could get paid for Medicaid services. Because we started talking about background checks, there were many peer support specialists who had a background of substance use. And these were individuals in recovery for many years, but they were very concerned that the background check process would mean that they could not be reimbursed peer support service workers. And so they came to our public hearing on traditional health workers, and they came organized with placards and signs saying that we were the Office of Inequity and Exclusion. And we sat and listened to all their testimony for hours. It was maybe, I don't know, 60 to 90 people who testified, and usually it's maybe 3 to 5 people who provide testimony. But we heard all of their testimony, and because of that, we were able to work out a process so that the background check process would not unfairly disqualify peer support workers who did have oftentimes a criminal history. So I wanted to share that story because what I want you to know is that public testimony matters. It's so important, it's very powerful, and it helped us understand the issue, but it also helped us be able to move the bigger background check process, and then to build a tracking system so that we could make sure that people of color weren't disproportionately impacted by the background check rules. Okay, I have only 2 more slides. I do see a question in the Q&A, but if I can pause now and take the question, Uju, or I can keep going and hold till the end. So let me just pause there and see how would you like me to proceed?
Thank you, Tricia. I would say let's answer the question now, and then we actually have a 10-minute break as a part. So we'll answer the question, 10-minute break, and then come back.
Okay.
Thank you.
Okay. So the question I see is, what does it take to bring a bill to legislation? The only thing you have to do, this is the simple answer, the only thing you have to do to make a bill that gets introduced into the legislature is find a legislator who will introduce your bill. That's it. But there's a difference between what it takes to get a bill introduced and what it takes to get a bill passed. So many bills get introduced. Many of them are introduced as a courtesy to the community member or the constituent of the legislator. So what it takes to actually successfully get a bill through session, through the legislative vetting process, and signed into law is a very well thought through concept, so very well thought through idea. If it's going to cost money, there has to be a strategy for how to account for those costs or to raise money for those costs, either through taxes or like new money that gets collected or reallocating, existing dollars. And oftentimes bills die because of the cost, because you're competing with all the other bills that have a cost with them. So oftentimes the bills that are successful, and it's not that they don't have a cost, it is that there's enough public support that even though there's a cost, agencies or legislators or the governor can either find a way to fund the idea or figure out a way to raise new funds or figure out a way to make that bill more competitive than other bills that are also asking for money. So advancing a bill in a coalition like OHE and then in partnership with other coalitions is often the way, or historically, the way that OHE has had a lot of success with making concepts into legislative bills and then getting those bills passed and then signed by the governor. So I hope that helps. In many cases, it takes multiple attempts to get a bill passed. And every attempt, and I'll talk a little bit more about this later, in every attempt, there's an opportunity to learn, to build more coalition, to build out your strategy, to build more allies. So if a bill doesn't pass the first time through, that doesn't mean it's failed. It just means it didn't pass this year. And I've seen multiple policy concepts that have taken years, if not decades, to pass. So another piece that it takes to bring a bill to make it into the legislative process and then get passed is tenacity, determination, patience, fight, struggle, all of those things. It's often not a fast process. So Uju, I can finish this 2 slides and then we can take a break, or we take a break now.
Let's take a break now. So it's 6:18. How about we reconvene at 6:28? Give folks some time from their screen and ability to take care of whatever needs to be taken care of. So we'll be back at 6:28. Alrighty, everyone. It is 6:28, so we're gonna jump back in. Can let us know you're here with a thumbs up or turning on your camera if that's possible. All right, looks like most folks are back. I will pass it back to Trisha.
Hey, so we can go on to the next slide. And this is about, okay, so let's say you had a bill, it became a law, and now you're sitting in the rulemaking committee. How do you participate? First of all, what I want to share is that you should feel completely comfortable in asking for language assistance or ADA accommodations if you need them. It, at this point, should be fairly routine for a rulemaking committee to know how to set up a simultaneous interpretation and ASL interpretation. And if you need it, to have closed captioning, if that is something that would make it possible or easier to participate. When you're sitting on a rulemaking committee, there are some things to be mindful of and to ask a lot of questions about. It's easier for me to share with you that you don't have to go into a rulemaking committee knowing everything about how a rulemaking committee functions or operates. There are many things about government process that is, many things that are confusing or where there's bureaucratic language or jargon, and it's okay as a community member, it's okay regardless to ask a lot of questions about what the language means, what the process looks like, and then to share feedback about whether or not you feel like you have what you need to be able to bring your voice into that committee space. So similar to what Lakitha shared about how a bill becomes a law, I would repeat again, it's so important to speak from your experience and to bring forward the voice and perspective of your community. And then to refer back to the legislative intent. And so the legislative intent means what's the language that existed in the legislation. Oftentimes there's a kind of some introductory language about the purpose of the law, and then there's all the details of the law. And in my experience, when I was doing rulemaking, it wasn't my legislation that I was commenting on, but if there was any language in the legislation about equity, then I knew that in the rules I could talk about some of the important aspects of equity, like culturally specific services or culturally specific organizations, or disaggregating data by race and ethnicity, or assuring culturally and linguistically appropriate services. And I could do that because if in the legislation it talked about equity or diversity or inclusion, I could say in the rulemaking, here's what this would look like if the agency were actually doing it. So and if the language existed in the legislation, we could expand on that in the rules. I would encourage you, if you're participating in a rulemaking committee, to ask a lot of questions about what is possible, and to really not be discouraged and not be stopped if somebody says no. Sometimes people respond no when they don't know what the options are, and they respond no even when there may be some other ways of moving forward that that person just hasn't thought of yet. And so I would say precedence matters. So precedence basically means that in some other law or in some other state, somebody has done this before. And so if you can point to how, maybe if you're working with the Oregon Health Authority, but you know that in the Oregon Department of Education, they did something similar, then you know it's legal, it's possible, and therefore it should be doable, or at least be able to be considered in the Oregon Health Authority. Similarly, if you know that something has been implemented in another state, then you know it's legal and it's possible and it should be considered within the whatever the rulemaking process is. That doesn't mean it will actually happen, but it should be considered. And there should be a real reason, a reasonable reason, if it can't go forward. So it's important to be prepared when you go into the rulemaking committee. And I would say that preparation comes through strategic conversations with your colleagues or your coalition or other community partners, so that you kind of know what you're trying to achieve as you're entering into that rulemaking committee. And then a lot of the thought process is, you know, how are we going to get to our desired outcome? How are we going to achieve our goal? And that comes again from, what did the legislation say? What are our community needs? What's possible? And what's happening in other jurisdictions? Next slide, please. Okay, so what happens if your bill didn't pass? So if your bill doesn't pass, you won't be moving forward into the rulemaking process. Let me just say that okay, I'm going to pause. I see there's something about noise with the interpreter. I don't know if that's my background noise or the interpreter's background noise. Okay, hopefully that is resolved. So if your bill didn't pass, like I mentioned before, that is not necessarily a failure. It doesn't mean that you're done. If it's something that you really want to see happen, you can always bring your bill back in a following legislative session. Sometimes that means you need to find another legislative champion. Sometimes it means that your legislative champion will want you to do some work with them in between sessions to generate more support. So you would want to continue to engage with your legislator, whoever introduced your bill, or other legislators who were co-sponsors of your bill, to see what are the opportunities to move the work forward beyond that legislative session. And we actually had that happen in our first legislative attempt at the Office of Equity and Inclusion, with a bill that focused on cultural competency continuing education for all licensed healthcare providers. So that included like doctors and dentists and nurses and social workers and psychologists. So many different different licensing boards. That bill actually failed the first time it went through the legislative process. And when it failed, one of the House members came out after it failed and said, it's all about electoral politics. And I didn't believe him. I was so mad. Like, this is not, I thought, this isn't about electoral politics. This is about courage of the people who are currently in office. But the partners that had been helping with this bill, they did turn their energy and their attention to electoral politics and helped change the makeup of the House in the next session. So in the next session, the bill did pass. So he was right. When our bill failed, it failed when the House had 50 Democrats and 50 Republicans. And in order for this bill to pass, we had all 50, or it might not have been 50-50, but 50%. We had all the Democrats in support, and we just needed one Republican to come and vote for that bill, and no one would. The next time the bill got introduced, the House was over 50% Democratic. So just by having all the Democrats vote for that bill, it was able to pass. The other question that I think is really important to ask is, does your concept actually need a law? Does the law actually have to change? Maybe just an administrative rule needs to change, or maybe just an agency practice needs to change. So when our bill on cultural competence failed, we decided, one of the legislators, one of the Republicans said, you don't actually need a bill for this. You don't need to change the law for this. And so we said, you know what, you're right. So we formed a committee to do some of the exploratory work that would have been in the law that helped inform the law when it got reintroduced later. So some of the work didn't need a law. It just needed some staff support and some attention and some community engagement to answer some questions. And so when we reintroduced the bill in the next legislative session, we were able to really focus in on the specific pieces of law that needed to change. And in this case, back to what I said about may or shall, we needed to give the licensing boards of the various healthcare licensing agencies permission to require cultural competence as part of the continuing education requirements that healthcare professionals have anyway. Incremental change. So even if your bill doesn't pass, like maybe the whole bill didn't pass, there still may be opportunities to work your language or your concept into another bill that has energy, if it is relevant, if it relates to that bill. So there may be pieces of it, and there may be pieces of your bill or your concept that could be put into agency practice. So an example of that is the prenatal care for all legislation, again, championed by OHE. All of these bills that I'm giving examples of, they were all championed by OHE. So the prenatal care access bill, that was focused on assuring that all mothers, regardless of citizenship status, would have access to prenatal care. It was not going to be possible for that bill to pass in Oregon for about a decade. And so the incremental change that happened was the advocates for that policy change were able to, without state leadership, work on a county by county basis to identify which counties would cover prenatal care for undocumented mothers and figure out a reimbursement strategy for that. Eventually, they were able to move to a state agency level where there would be a pot of funds that were used to cover the cost of prenatal care for undocumented women. And then there was enough support at that point to move forward, and the makeup of the legislature had changed enough at that point that the bill was able to pass. But it took multiple different strategies of incremental change to be able to move that legislation to become a law. Another example of that is Basic Rights Oregon. They started doing some work around assuring coverage for individuals who were considering a gender transition. And so instead of looking at legislative change, they looked at administrative change around what kinds of services would the Oregon Health Plan pay for. So there's ways to take your broad idea, your broad concept, and break it down into little pieces of administrative change that may not need legislation to go forward. And then the last one, and I think this is not just if your bill doesn't pass, but in order to get your bill to pass, you need to be prepared to compromise. And that really is the strategy for the long game. It kind of goes along with the incremental change. So it's always good when you have a legislative concept that you have like your dream, your ideal, but then you have to break it down into like, what are the acceptable pieces of change that still will help move the conversation forward to completion at some future time. So it doesn't mean compromising your morals, and it doesn't mean compromising your values or your ethics. It does mean thinking about your strategy for the long haul. And one of the lobbyists who was really, really helpful for our work at Oregon Health Authority and with OHE, the question that she would ask was, do you want to be right or do you want to win? And that recognized that in the legislature, sometimes moving forward with this idea of wanting to have complete change is not a winning strategy. Because the legislature really exists to make incremental change. And it's very rare that you see large scale reforms happening in one legislative session. Often it takes many, many sessions with lots of community work and lots of energy over time to see significant reform. As an example, the healthcare reform effort that happened in the Obama administration, which happened to be when I was at the Oregon Health Authority, it all happened in the same like 3 or 4 years, it seemed like. But that was really a reflection of decades of organizing work that had happened, many failures at the federal level and at the state level, lots of organizing to be able to get Oregon to a place and to get our nation to a place where that healthcare reform could happen. So thinking about the long game is not a bad thing, it's a hard thing. but that strategy helps for some of the bigger changes that you want to see. Okay, I think that might be my last slide. The final slide is just a question, what questions do you have? I want to make myself available. I am a fan of OHE. I am supportive of your work and your leadership. You have a beautiful decade-long tradition of significant equity policy change that has impacted the whole state of Oregon. Even though you're a regional health equity coalition with touch points in Washington, Clackamas, and Multnomah counties, your impact has improved the health and the lives and the well-being of everyone in the state of Oregon. So I'm just a big fan. I'm here to support you, and then happy to answer any questions that you have.
Wow, thank you so much, Tricia, one, for that amazing presentation. And also just, yeah, I mean, every time I listen to you speak, I'm learning something new. So I'm very grateful that you were able to, speak to folks. In fact, just this morning, we had a conversation and someone was asking on our policy committee, like, what happens if a bill doesn't pass? What do we do? So I just want to reiterate how appreciative and grateful we are for your support and for you to host this workshop. And I want to give folks the space to please, Tricia's brilliant. If you have any questions, I know that we do have one in the Q&A, but if you have a question, please feel free to post it in the chat box or Q&A, or you can raise your hand and I will unmute you so you can talk aloud. And then while we're waiting for folks, I know the question that we have, Tricia, is how do public comments influence the development of the rule?
Yeah, so the public comment period would happen after the rules have been drafted. And my approach to the public comment, sorry, I have a puppy on my lap and he is trying to participate. So the public comment period happens after the rules have been drafted. What I would do is I would go through the rules, the proposed rules, line by line, and identify either what language needs to be clarified, what language needs to be expanded, what kinds of concepts exist or are missing from within the rule process. And then when you put those into your either written comments or your public comments, the agency people who are finalizing the rules would determine which of your suggestions can actually be incorporated into the rule, and then which ones can't. If they can't be incorporated into the rule, it may be because the comments don't align with the legislative intent, or if there's something that another rule exists that prohibits the agency from operating in that way. But again, I would say that if the agency says we can't do this, but you have examples of how other agencies have or other states have done that, by providing that in your comments, that helps to create more justification for why the agency needs to find a way to make those changes.
Thank you, Tricia. And I see someone has their hand up, Wada, so I'm going to allow you to speak.
Thank you very much, Latricia, for this very valuable information. I really appreciate it. Now, if the bill passes, how long it takes to be implemented and be part of a law? And if it does not pass, how long it takes to appeal it and redo the bill again?
So when you look at the legislation that is being proposed, the very last line of the bill will say when the bill needs to go into effect. And so in some cases, if there's an emergency clause, the bill will go into effect upon the governor signing it into law. It will go into effect immediately. Some bills, they won't go into effect for some time. It could be 60 days or 90 days or in a year, depending on what the actual legislation says. And in some cases, it depends on how complex the rules are that need to be put in place for implementation. So an example is, I think like with I'm not sure if it was legislation or if it was a ballot measure. It might have been a ballot measure on legalizing recreational marijuana. It didn't go into effect for some time because there had to be this complete overhaul of all the rules within public health, within addiction services, within the OLCC, which is the Liquor Control Commission. Because all of those agencies had to change their rules. One, there was a lot of rulemaking committees and a lot of engagement from many different interests. But that also meant that there had to be a longer runway to get that bill, to get that legislation implemented. If your bill doesn't pass, there's a couple of things that can happen. There's two ways that your bill could go forward. So in some cases, it might be communicated to you that if your bill didn't make it out of committee by a certain time, or it didn't get voted on by a certain time, that it died, right? It died in the legislative process. But there's always an opportunity to get your legislative concept incorporated into what they call the Christmas tree bill at the end of a legislative session. And that's sort of the bill that is the catch-all of all the legislative concepts that people wanted. There's some advocacy, but it's like the diving catch, right? The last minute opportunity to get legislation passed. And so that would really require very close communication and a high priority for that bill by your legislative champion. So that's one thing. So bills are not dead until the session is actually over. There's always a chance, it's a very small chance, that a miracle could happen at the end and there's a home that's found for your legislative concept before the end of session. But if session ends and your bill didn't pass, then it's really dead. But you would work with your legislator to potentially introduce it in the next session. And the state of Oregon alternates between a long session and a short session. Short session we just finished. So even numbered years are short session, odd numbered years are long session. The idea of short session is that it's really just supposed to be easy fixes in legislation, like to close a loophole or to focus on like smaller asks. And so there's fewer bills that get introduced and the session is supposed to go faster without as much controversy. It doesn't always work like that. Long session is when the legislature spends more time to work through more complicated legislative issues, to pass a budget. And so there are more bills that get introduced during long session, more bills that die during long session, but more bills that pass as well during long session. So depending on the kind of bill that you're trying to introduce, the legislator may say, let's bring it back in the next long session, or let's bring it back next year. But in any case, it wouldn't be reintroduced until the next session, and session typically starts in February, regardless of a long session or short session. It's just short session ends in 6 weeks, and long session, so middle of March, and long session ends, I think it has to end by July at the latest.
Thank you very much. I really appreciate it.
All right, we are at 6:58 and I want to be respectful of folks' time. So I want to just say again, thank you so much, Tricia, for this valuable information. I didn't say this in the beginning, but context for these workshops is that, you know, Tricia talked about some of the advocacy work that OHE has done in the past couple of years. And we do have, whether you're on the community action team, I know a couple of you are on our CAT, or other folks on our policy committee who are newer to policy and advocacy work, and asked for like just kind of slowing down and breaking it down. What is policy and advocacy work in Oregon, and how can we best advocate and support our communities towards racial justice, health equity? So that's why we're doing this. So again, thank you all for coming. Thank you, Tricia, for presenting today. This was recorded, and we will send out a link to the recording in like 2 weeks, because it does need to be translated, transcribed. And then, yes, we can share slides afterwards as well. This won't be the last workshop. We're hoping to have a workshop every month, every other month, that is focused on just breaking down the process of, one, how a bill becomes a law, but also what is a different like organizing policy strategies that get us to where we want to be.
And I just want to say thank you. And I put in the chat that I do this in honor of Senator Avil Gordley, who was Oregon's first elected African-American senator, female senator. And she really was the shoulders that I stood on in doing my equity work, and is really all about beloved community. And so OHE continues that tradition as well. So thank you so much.
Thank you, Tricia. All right, it's 7 on the dot. Thank you, everyone. Thank you to our interpreters and captioners. I hope you have a lovely rest of your Thursday evening, and hopefully see you at our next workshop.